الرحمن الرحيم بسم الله الرحمن الرحيم. السلام عليكم، نهاركم سعيد متابعينا على صفحة الفيسبوك من المركز الوطني لأمراض القلب. اليوم حلقتنا حتكون مواصلة لسلسلة حلقات حديث القلب. هذه الحلقة حتكون مميزة لأننا سوف نتطرق إلى موضوع من الأمراض المتواجدة بكمية، ألا وهو ارتفاع ضغط الدم. فأرجو من مشاهدينا يعني متابعتنا على الصفحة، وإذا كان عندهم أي أسئلة تابلودت. الموضوع هيكون عن أمراض القلب وكيف نتعايش معها. معنا الدكتور حافظ بن هادي، هو استشاري أمراض القلب ومختص في الموجات الصوتية لصدى القلب. هيكون معنا خلال هذه الحلقة. بسم الله الرحمن الرحيم, and very good afternoon everybody. We are continuing our series of this Heart Chat Arabic version from our Facebook page at the National Heart Institute. I'm Dr. Afra Haroon. I'm a cardiologist. So today we're going to discuss one of the hot topics, and it's a common medical problem, which is high blood pressure. The topic for today is high blood pressure and how to live with it. With us, we have Dr. Hafiz bin Hadi. He is a consultant cardiologist, and he's specialized in echocardiogram. So Dr. Hafiz will talk to us with the high blood pressure and how we are going to live with it. Without further ado, I will give the floor to Dr. Hafiz to elaborate more. So, Dr. Hafiz, if you never mind, can you just tell us what is high blood pressure, how to measure it, and how usually, if any symptoms, if there is any symptom with regard to this high blood pressure.
All right. Right. Thank you, Dr. Afra. Well, first of all, I'd like to thank Dr. Afra for inviting me here to give a talk. I'm Dr. Hafiz Abdul Hadi. I'm one of the consultant cardiologists. I'm going to talk to you about hypertension and how to live with it. So as a start, I think before we get into the details of the questions, I think it's important to know the background of hypertension. Right now, I think hypertension is very common among the people, among the public. In fact, if you see the statistics by the WHO in 2015, it's been estimated about 1.13 billion people has hypertension. And then if you break down the statistics into smaller details, you can see that 1 out of 5 females has hypertension, and 1 out of 4 females has 4 males has hypertension. 1 out of 4 males have hypertension.
It's a very high
prevalence. Yeah. So it's very common, and it's one of the most highest non-communicable disease in the world. Yeah. So following that, I think before we begin to talk about hypertension, I think it's important to know the concept of a blood pressure first. So if you look at the blood pressure, what's the blood pressure? Blood pressure is actually the force that's been exerted by the heart into the walls of the arteries. Okay, so it has 2 components. One is the systolic component, which is the top part, and then one is the diastolic component, which is the lower part. The systolic component is the force being exerted when the heart is pumping or contracting. So that is the systolic component. And then the diastolic component is when the force that's been exerted on the walls of the arteries when the heart is relaxing.
So you are telling us that if the patient having a high blood pressure, that means the heart it need to bump higher. So that means there is some sort of stress.
Resistance, they call it resistance.
Upon the heart.
Okay, so once we know the concept of the blood pressure, then it's easy to understand what is hypertension. So a normal blood pressure is about 120/80 millimeter mercury. That's the normal average blood pressure in a normal person.
Is it a fixed number, or how is it defined?
Well, hypertension is being defined as blood pressure of persistently more than 140/90 in an office BP. So numbers which continuously exceeding more than 140 is considered as hypertension. Anything below that is usually considered as normal. So yeah.
All right, just I will stop you for a while just to tell my Arabic people. So كما ذكر لنا الدكتور حفيظ بن هادي عن ضغط الدم، وانه هو من الامراض المنتشره، وكما شاهدنا في واحده من الشرائح المعروضه انه معدله يعني حوالي مريض لكل 5 مرضى من السيدات او مريض لكل 4 مرضى من الرجال. يعني ده بيعني انه معدل انتشاره عالي جدا جدا. بالنسبه لارتفاع ضغط الدم زي ما ذكر الدكتور حفيظ انه هو عندنا منه الضغط الانبساطي والضغط الاسفل. فاللي هو عندنا زي ما تظهر القراءه في قراءه انبساط والقراءه بتاعه الضغط. الضغط الطبيعي قياسه ما بين 120 ل 80، لكن في النهايه هي معدلات ما رقم ثابت. زي ما ذكر لنا انه قد يكون من 140 لحد 90. اي معدلات اكثر من ال 140 تعتبر ارتفاع في ضغط الدم. زي ما ظاهر لنا هنا في الشريحه المعروضه. دكتور حفيظ يسترسل لنا في الحديث عن اسباب ضغط الدم وكيفيه الاعراض المصاحبه لها وكيفيه يعني التعايش معها. اوكي. You can continue to Hafiz, just telling us more about the symptoms and
All right. So before we start diagnosing a person of having a hypertension, it's important to know, it's important to take the blood, to do a blood pressure monitoring appropriately. So when you want to take a blood pressure using the BP cuff machine or the automated machine, you should do it in a quiet room where there's no disturbances. You should not eat before taking a blood pressure. You should not exercise or wait at least about 30 minutes after exercising to take your blood pressure. And at the same time, you should empty your bladder before taking a blood pressure, because all these things can actually changes or increase your blood pressure indirectly. We want to take your blood pressure at the ideal and optimum environment. And then following that, when you want to take the blood pressure, so you should be in a fixed seated position, upright position with your arm on the table, about the same level as your heart. And at the same time, your blood pressure cuff should be encompassing about 75 to 100% around your arm. And then you should take at least 3 times. 3 times they're measuring your blood pressure with 1 minute apart.
Oh, so you are telling us like checking the blood pressure is not like just as simple, get the device and check and that's all. So even the stress, the exercise, and all these kind of take the blood pressure.
Can affect
okay, just let me tell them. Alright. كما ذكر لنا الدكتور حفيظ بن هادي بالنسبة للطريقة المثلى لقياس ضغط الدم. فهي الطريقة المثلى مفروض المريض يقيس ضغط الدم كما موضح في هذه الشريحة، إنه يكون في وضع الجلوس، أقدامه على الأرض. الجهاز اللي بيستعمل إحنا عندنا الوثاق بتاع الذراع، يعني يكون بيغطي حوالي 70% يعني 75% إلى 100% من حجم الذراع، من طول الذراع. وقبل قياس ضغط الدم على المريض إنه ما يجهد نفسه، يعني بيعمل أي نوع من التمارين لمدة نص ساعة قبل قياس ضغط الدم، يكون في غرفة هادئة وما يكون أخذ أي وجبة قبل قياس ضغط الدم. ده بالإضافة لإنه زي ما قلنا يعني يكون في غرفة هادئة جدا، حتى بعد ذلك يكون بقياس ضغط الدم. ولازم يعني وضع اليد يكون على مستوى في نفس مستوى في نفس المستوى بتاع القلب، يعني كما موضح في الشريحة. Okay. All right. So now we know how to measure the blood pressure. It needs like a certain position and situation.
Yeah.
Okay. Just back to the blood pressure.
Yeah.
Okay. How does the blood pressure affect our bodies?
So Typically, when a person is having an uncontrolled hypertension, in the long run, it's not good. Most of the time, patients remain asymptomatic, means to say that they don't have any symptoms at all. But in the long run, this uncontrolled hypertension may lead to other problems. For example, heart attack. It increases the risk of heart attack because it accelerates the progression of atherosclerosis in the vessels of the heart. It can also lead to either stroke, that could be either a infarct, which is actually a sudden occlusion of the vessels of the brain, or a bleed. It could lead to blindness in the severe ones, and then it can also affect the kidneys. So these are the long-term complications which may affect patients with uncontrolled hypertension.
So that means, yes, like some patients, they can have this high blood pressure for quite a long time without knowing they are hypertensive.
Yes.
Only they came when they develop all the complications and the side effect of this high blood pressure. Okay, كما ذكر الدكتور حافظ بن هادي وذكر لنا إنه ارتفاع ضغط الدم قد يكون خالي من الأعراض. يعني في بعض المرضى يعني بيكونوا عايزين يكون في أعراض، يعني مثلا في ناس بيقولوا ارتفاع صداع أو زيادة في الضربات أو غيره. في معظم الأحيان ارتفاع ضغط الدم بيكون من غير أعراض، والعرض الوحيد اللي بيحصل بعض مرات يعني كبداية لظهور المرض قد تكون هي مضاعفات المرض ذات نفسه. يعني المريض ممكن يجينا بالنوبة القلبية، ممكن يحضر بالسكتة الدماغية، بدرجة الفشل الكلوي، وكما عارفين لأنه يعني ضغط الدم هي زيادة في الضغط الشرياني، يعني الضغط الشرياني بيكون فيه ارتفاع، فممكن يؤدي لانفجار الشرايين الدقيقة الموجودة في العين اللي هي قد تؤدي إلى العمى. فارتفاع ضغط الدم عنده آثار والمخاطر بتاعته كثيرة جدا. عشان كده حلقة اليوم عندنا يعني حتكون عن كيف نتعايش معه وكيف نقلل من هذه المخاطر. Okay, Dr. Hafiz, you're telling us this high blood pressure, it has a lot of complication, and some patients they can present even with this heart attack, brain attack, and renal failure. All right. So, what's your recommendation for patient if the patient say he doesn't know that he has blood pressure? So, usually, what should we do?
All right. So, well. Again, just repeating what you've mentioned to you, what I've mentioned to you earlier, is that most of the patients do not have any symptoms at all. Hypertension is known to be a silent killer, and then by the time they present with symptoms, it's already too late. They have end organ damages, and at the same time, what you can see is that those who present with symptoms of hypertension typically presents with blindness, severe headaches, feeling nausea and vomiting, and sometimes feels lethargic. So these are typical symptoms, and sometimes the severe ones also may have nosebleeds. And these are the blood pressure which exceeds, or the systolic blood pressure exceeds more than 180, and the diastolic pressure of more than 120.
But usually this is not the common one. It's still
This can occur, but not the common
so
ones.
We shouldn't depend on this.
Yeah,
we wait till I have this headache, this nausea.
Yeah, you should not
and then only
wait.
I go to see my doctors.
Yeah, so you should start screening yourself, actually doing a blood pressure monitoring at home, which you can invest on your blood pressure machines, which is not that expensive actually. And then you can take your blood pressure for about twice a day during at the similar period. Again, doing what I've explained to you, how to take a blood pressure machine, and have a blood pressure diary. So if you're hypertensive, it's good to have a diary, but if you don't, you can do it once a week just to check on your blood pressure, and your blood pressure should not be about more than 140/90.
Okay, Dr. Hafiz, just ask you, because like usually as normal people, we don't check our blood pressure as usual.
Yeah.
Okay, and right now you are telling us we have to check our blood pressure twice a week. This for hypertensive patients.
These are for hypertensive patients.
If I'm someone having no blood pressure from before, like do you have a special group of people you advise them to go and check their blood pressure and then to follow on that, or each person has to?
Okay, so in such a case, if one does not have any medical conditions or problems before, you should do a yearly or a once a year screening if possible, if you can afford to do it. By doing a screening, you can actually not only check on your blood pressure, but also you can check on your weight, your sugar levels, your cholesterol levels. And by doing those things, and you can check also your other organs, for example, your kidney functions, your liver function, and so on. By doing a screening, because hypertension does not come alone, it sometimes comes with uncontrolled cholesterol levels and uncontrolled diabetes. So it comes hand in hand actually.
alright. زي ما ذكر لنا دكتور حفيظ إنه ضغط الدم بيسمى القاتل الصامت، silent killer. يعني ممكن العرض الأول يكون هي الموت. فهو من يعني زي ما ذكر إنه في الغالب ما عنده أعراض، لكن في بعض الأعراض ممكن تحصل إذا ارتفاع الضغط الانقباضي إلى معدل 180. يعني ممكن يكون في غثيان، ممكن يكون في دوخة، ممكن المريض يحس ب يعني استفراغ أو يكون في صداع، لكن دي ما هي الأعراض الموجودة. فعشان كده هو دايما يعني بيدعي المرضى انهم يعني يقوموا بقياس ضغط الدم، يقوموا بقياس ضغط الدم بالذات اذا كان المريض هو عنده ارتفاع في ضغط الدم مرتين او ثلاثه، يعني مرتين في الاسبوع. اذا المريض ما عنده اي يعني تاريخ مرضي بالنسبه لارتفاع ضغط الدم، زي ما ذكر الدكتور حفيظ انه هو يعني يدعو المرضى انهم يقيسوا ضغطهم بالذات اذا كان في الاسره هو موجود، تقيس ضغطك مثلا كل 6 شهور او مره في السنه عشان تتاكد انه ما في ضغط. زي ما ذكر هو القاتل الصامت. عندنا بعض الاسئله يا دكتور حفيظ. ما هي اوكي السؤال عن ارتفاع ضغط الدم، يعني اذا كان لفتره. اوكي there is one question here Dr. Hafiz. Someone asked about the blood pressure, if someone having had blood pressure for more than 30 years.
3 years.
30 years.
30 years, right?
Yeah. What are the complications that are expected?
Right. Right. So, which I mentioned to you earlier, in the long run for 30 years, if it's been well controlled, the complication is less. But if it's well controlled, then you can see more complications, which, for example, it can affect the heart, it can affect the kidneys, it can affect the eyes, it can affect the brain as well. So, so if you have a long-standing hypertension, but if it's well controlled, most of the damages can be prevented. So, which already been stated earlier.
اوكي ردا على السؤال. زي ما ذكر دكتور حفيظ، ارتفاع ضغط الدم يعني ايا كانت الفتره بتاعته ممكن اذا كانت يعني اذا كنت انت محافظ على ضغط الدم بتاعك في معدلاته الطبيعيه، في الغالب ما يكون عندك مضاعفات لهذا المرض. لكن اذا كان ارتفاع ضغط الدم غير منتظم، فغالبا المريض بيكون معرض لكل الاعراض، يعني لكل المضاعفات من فشل كلوي ومشاكل بالعيون وبالإضافة للسكتة الدماغية والذبحة القلبية. We have one slide here that Dr. Hafiz just talking about the blood pressure.
Yeah.
There is one primary and essential hypertension or secondary hypertension. Okay. Can you tell us what the difference between the two?
Well, primary hypertension is usually hypertension which gradually develop over years, whereas the secondary hypertensions you have secondary causes, and one of the causes of secondary hypertensions, it can be because of kidney problems. It started off with a kidney problem instead of hypertension. Okay, and the next one will be certain endocrinological diseases, for example, thyroid problems or adrenal problems also can lead to hypertension. Other secondary causes could be because of congenital. When the person is young, it's born with a disease called coarctation of aorta. Certain medications can cause, for example, antidepressants as well as some oral contraceptive pills can lead to hypertension if being used in a long period of time.
اوكي مشكور. ثانك يو فيري ماتش دكتور حفيظ. مشكور دكتور حفيظ. زي ما ذكر لنا دكتور حفيظ يعني في نوعين من ضغط الدم. في واحد اللي بنسميه الاساسي والثاني بنسميه الثانوي. الاساسي ده هو ما عنده اي سبب، يعني بتتعامل كل الفحوصات بيكون ما في سبب واضح، فبالتالي بيظهر بيسميه ده ضغط الدم الاساسي. وعاده بيحصل في الناس اللي هم يعني اكثر من عمر ال40 سنه. ضغط الدم الثانوي اللي هو بيكون عنده اسباب، يعني بيكون هو ثانوي لامراض الكلى او امراض الغدد الصماء او لبعض الامراض اللي مثلا اللي هي العيوب الخلقيه في الاوعيه الدمويه. دي قد تؤدي لارتفاع ضغط الدم، ده بالاضافه لبعض انواع الحبوب اللي بعض المرضى بياخذوها لامراض ثانيه، يعني مثلا العلاجات اللي بتتاخذ بعض الامراض النفسيه او عند السيدات اللي هي حبوب منع الحمل. حبوب منع الحمل ممكن تكون من الحبوب اللي بترفع ضغط الدم. We have one question, Dr. Hafiz.
Sure.
Okay, Mr. Wael, he's asking about what is the possibility of a person who is less than 30 years to have high blood pressure? Is it common?
Less than 3 years.
30 years. 30.
Oh, less than 30 years. Well, it is rare for a patient to have hypertension with the age of less than 30 years. But if one were to have hypertension, then we should investigate causes of secondary hypertension, which I mentioned to you earlier. It could be endocrinological problems. It could be because of kidney problems. It could be because of taking certain medications which may lead to hypertension. So these are the things that needs to be investigated, and there are several tests that needs to be done.
And what about a young patient who is a little bit obese or having a family history of this high blood pressure?
Well,
is it possible for them to have it at early age?
It is possible. It is possible, but it's not that common. Well, if it's a young age, typically the doctor or the physician will try to investigate the secondary causes first. In the event that we can't identify any possible secondary causes, then we will say that this patient is considered as primary hypertension.
اوكي احنا حنرد على الاخ وائل. هو سأل اذا كان ارتفاع ضغط الدم ممكن يحصل للشباب في سن 30 عاما. زي ما ذكر دكتور حفيظ الاحتمال بسيط، يعني ما عالي الا اذا كان في تاريخ مرضي في الاسره، انه في ارتفاع مريض يعني بيعاني من السمنه. وفي القالب إذا كان عنده يعني ظهر له أي ارتفاع لضغط الدم كثير، يعني عادة الأطباء بيبدوا يبحثوا عن الأسباب الثانوية. يعني زي ما ذكرنا إنه ضغط الدم الأساسي بيحصل في عمر ال40 عام وما فوق. أقل من كده بيكون هو عادة الأسباب الثانوية. فإذا مريض في عمر ال30 ظهر له ارتفاع في ضغط الدم، أكيد الطبيب المعالج هيقوم بفحص بإجراء كل الفحوصات فيما يختص بالأسباب الثانوية لارتفاع ضغط الدم. أوكي دكتور حفيظ. Okay, just I can see one slide. It talk about high blood pressure and how to prevent it.
Yeah.
If you can just tell us more about that.
Right. This is basically focusing on patient with primary or essential hypertension. Basically, if you have hypertension, these are things that measures that you can do to help to control or to prevent it. So number one is actually to watch your salt intake. If possible, your salt intake should be about 1 to 1/4 tablespoon a day. And then have a healthy diet. For example, eat more greens and fruits and vegetables. Avoid red meat if possible. Take more of lean meat, for example, fish or chicken. And then if you're a smoker, quit smoking, reduce alcohol intake, and do physical exercises regularly if possible. Now, ideally, physical exercises should be done for about 5 times a week, about 30 minutes in average if possible. And then if you are able to identify a lot of stresses around your environment, try to address those stresses and try to learn how to have a stressor coping mechanisms. For example, learning how to do a breathing technique to manage your stress at times when it's difficult.
Okay, so for example, if I don't have high blood pressure and I follow all these instructions like taking a less salt, less oily food, I avoid my smoking. So it prevents me to have the high blood pressure.
So it helps to reduce the likelihood of developing hypertension. We have to bear in mind that hypertension also, there are non-modifiable risk factors which can lead to hypertension. For example, age is one of the contributory factors. Hereditary can also cause hypertension as well. So, however, despite you having those non-modifiable risk factors, by doing these steps actually helps to delay or actually slows down the progression of you developing hypertension in the later years.
Okay, كما ذكر لنا دكتور حفيظ يعني في عدة طرق بإمكان المريض يتجنب بها أو حتى اللي ما عنده ارتفاع ضغط الدم يتجنب بها ارتفاع ضغط الدم. واحدة منها اللي هي تقليل كمية الملح في الطعام، ويعني الملاحظ العرب يحبوا الأكل الطاعم جدا وفيه كميات من الملح، لكن الملح هو من الأشياء المضرة جدا. فإذا يعني بقدر الإمكان تفادينا أو قللنا كمية الأملاح اللي بناخذها في الطعام يكون أفضل. ده بالإضافة للإكثار من أكل الفواكه والخضروات، لأنه بعوض لنا الأملاح اللي الجسم بيكون فعلا محتاج لها. ده بالإضافة لتجنب الدهون بالذات الدهون المشبعة، ودي نصيحة لكل المدخنين تفادي التدخين. يعني التدخين معروف آثاره الجانبية، بالإضافة لتقليل الكحول. وأكيد التمارين الرياضية هي من الأشياء المحبذة والمطلوبة لأي مريض عنده ارتفاع ضغط الدم، وحتى اللي ما عنده عشان يتجنب ضغط الدم، ارتفاع ضغط الدم. زي ما ذكر لنا لأنه في بعض مسببات ارتفاع ضغط الدم بإمكاننا نتجنبها اللي هي عن طريق الرياضة والأكل وغيره، لكن في أشياء ثانية إحنا ما حنقدر نتجنبها اللي هي الزيادة في العمر أو إذا كانت في أي أسباب جينية، يعني مثلا موجود في الأسرة أو غيره. فالمجموعة دي من الناس عليهم اتباع التمارين و يعني الاتباع النظام الغذائي والابتعاد عن التدخين. Okay, we have one slide, Dr. Hafiz, just talking about medication.
Yeah. So, if let's say, for example, all those things that which I mentioned to you earlier has already been done, has already been addressed. So, and the person's blood pressure is not well controlled. So, these are the physician or the doctor will consider starting the patients on these kinds of medications. So there are many types of medications, but these are the major ones which I've lifted up. So the first one is actually diuretics. This is known as the water pills. So it helps to reduce the blood pressure by making the patient or the person to pass more urine. The beta blockers and the calcium channel blockers are medications which actually helps to slows down the heart rate at the same time relaxes the arteries, so hence reducing the blood pressure. The angiotensin converting enzymes and the angiotensin 2 receptor blockers are medications which prevent certain chemical production or in our body, which also relaxes the arteries of the human body, hence reducing the blood pressure.
Okay, just talking about the drug. Okay, do you feel all patients with high blood pressure, like if you discover him today he has high blood pressure, does he need to start his medication immediately, or how is it?
Well, it depends on, it depends, you have to take a lot of things into consideration. First of all, you need to assess the patient, whether is he going to be a good patient where he's going to be compliant or not, and then what is his motivation first. So normally, typically, I would recommend the patient to do all the measures which I mentioned to you earlier, watching the diet, get the weight down as low as possible, eating healthy, exercise regularly, and if all things fails, then I would
and
consider.
For how long he has to continue on the?
Well, usually I would consider giving them about 3 months, in average about 3 months. But those patients who present to us or present to me with persistently uncontrolled hypertension, very high readings, persistently, I would not consider waiting for them to actually do those measures. In fact, I will start them immediately on medications if their readings is tremendously high, for example, persistently more than about 150, 160 and above. I would consider them to start on the medications immediately.
اوكي ثانك يو دكتور حفيظ. زي ما ذكر لنا دكتور حفيظ انه توجد عديد يعني في عدد من العلاجات اللي ممكن المريض ياخذها لعلاج ارتفاع ضغط الدم. واحده منها اللي هي احنا بنسميها مدررات البول، اللي هي بتقلل كميه السوائل الموجوده في الجسم، فبالتالي بتقلل من ضغط الدم. عندنا انواع من العلاجات اللي هي بنسميها احنا قافلات المحرك بيتا او البيتا بلوكرز او الكارسينوجينيك بلوكرز، اللي هي دي نوع من الادويه بتعمل على انبساط يعني الجدار بتاع الشرايين، فبيقوم بيقلل من ضغط الدم. عندنا ادويه ثانيه اللي هي بتشتغل عن طريق العمل الهرموني وتاثيره على معدل ضربات القلب، وبالاضافه للريلاكس يعني الانبساط بتاع الجدار الضغط الشرياني. لكن الحاجه اللي اكد عليها دكتور حفيظ انه الواحد لو التزم بالنظام الغذائي والرياضه والابتعاد عن التدخين قد تكفينا انه الواحد ياخذ هذه الادويه. وفي العاده زي ما ذكر لنا انه ما بيبدو العلاج يعني على طول. يعني مثلا انت جيت اليوم لقيت انه الضغط بتاعك عالي، ما بتبلي معاك العلاج الا بعد 3 شهور. لكن في بعض الحالات اذا كان انت جيت بارتفاع ضغط الدم عالي جدا، قراءات تصل الى 180، او جيت بارتفاع ضغط دم وكان معاه مضاعفات، ففي الحاله دي لازم يبتدى معاك العلاج. وحكايه انه العيان يعني يستمر على النظام الغذائي والرياضه والتمارين بتعتمد على شخصيه الفرد ذات نفسه. اذا كان هو عنده القناعه بانه ممكن يلتزم بالنظام الغذائي، يلتزم بالتمارين، فدي تكون بالنسبه له فرصه، لانه ممكن يقلل بها كثير من اعراض ومضاعفات ضغط الدم. Hafiz, just before we go to this slide, I want to ask you, is there any other ways like to control the blood pressure rather than taking medication?
Okay, so apart from having a healthy lifestyle and also medication, and despite those measures also the person may not be able to control the blood pressure, there are newer technologies, but again these newer technologies still need further research. But so far at this point of time the results has been promising. There's a new procedure called renal denervation. It's not that new, but it's been a while, quite some time already. But there's been improvement in the techniques of doing the procedure. So previously it was known not to be effective, but there's some improvement in the techniques which actually helps to improve the blood pressure. What it does here for renal denervation is actually they burn one of the nerves which is encompassing the renal arteries. So by doing that, it helps to reduce the sympathetic drive and indirectly controls or relaxes the vessels or the arteries of the human body, hence reducing the blood pressure.
I think it's very interesting. So like, is it like it's a kind of a new device or a new procedure you do to the patient, and then after that the patient, he doesn't need to take his medication, or still he needs to take them, but with less amount of medicine?
Probably, typically you need to follow up this patient first. The medications will still be continued, but in the event the blood pressure starts, we can see that the trend is it's a downward trend in terms of the blood pressure. Then the physician or doctor may consider reducing the number of medications taken by the patient.
I have one question here. There is like actually one of my friends, he asked me, on most of the patients. They keep asking, okay, I had high blood pressure, I was given this medication, and now my blood pressure reading is quite good, like normal reading. Should I stop taking medication, or how is it? Like, is it kind of a lifelong medication, or once my blood pressure comes to a normal reading, can I stop it?
All right. So this is a very common question. Normally, if a patient was to ask me, I would advise him to continue taking their blood pressure medications if they don't have any symptoms of hypotension typically. Because of hypotension, they may feel giddiness and may fall down as a result. So if you don't have any symptoms, I would advise them to continue because they are stable and well with it. In the event that they were to stop those medications, the risky part here is that the blood pressure becomes uncontrolled again. But nevertheless, there is still a possibility of us reducing those medications because the patients may be motivated to watch his lifestyle, for example, exercise, getting the weight down as much as possible, reaching the appropriate BMI, and then watching his diet. So all these things can help to reduce the number of medications, but it depends on the discussion between the patient and the doctor themselves.
All right, thank you. اوكي، زي ما ذكر لنا دكتور حفيظ انه في علاجات جديده او هي طريقه جديده لعلاج ارتفاع ضغط الدم اللي هي بيسموها renal denervation، اللي هي تقريبا عباره عن يعني كي للاعصاب الموجوده في شرايين الكلى. بالطريقه دي احنا بنقلل من تاثير الاعصاب على ارتفاع ضغط الدم. هي دي طريقه جديده قد تقلل من كميه الادويه الممكن المريض ياخذها، وحتى هي حاليا موجوده عندنا بالمركز القومي لامراض القلب. هي تحت الدراسه، لكن رغم انها هي بدات يعني من فترات طويله جدا، نتائج لحد الان كويسه، لكن بتحتاج لمتابعه المريض. لكن الحاجه المهمه اللي ذكرها دكتور حفيظ انه الاهتمام بالعلاج ومتابعه العلاج. يعني في بعض المرضى بيقولوا ان احنا لو اخذنا العلاج والضغط بتاعي انخفض، هل انا اوقف العلاج؟ هو بقول لا، العلاجات بتاع امراض القلب هي على مدى الحياه، الا اذا الضغط انخفض خالص. خلاص، هي علاجات حتكون مدى الحياه. فالعيان المريض لازم يلتزم باخذ العلاج بتاعه بالجرعه المحدده في المواعيد المحدده عشان يقلل من مخاطر مضاعفات ارتفاع ضغط الدم. عندنا سؤال ثاني دكتور حفيظ من الأخ عبد الرحمن. Okay, we have one more question, Dr. Hafiz, from one of our followers. He is asking about, if the blood pressure continue to be high in spite of taking medication, what to do?
Yeah, so we will exhaust. Typically we will exhaust all the medications, and in the event that the medication, because medication is not just one tablet, it's multiple tablets. And then also the important things that we need to identify is that the patient is actually compliant to the medications, because compliance has always been an issue when the patient presents with hypertension uncontrolled despite of medications. If all things fail, then like we discussed earlier, that this patient may be subjected or can be a candidate to consider renal denervation as a alternative or an option.
Actually, our follower who asked, Mr. Abdurrahman, he said he's taking bisoprolol twice a day, and still his blood pressure is around 150/80. He's taking 5 milligrams.
Okay, right. Well,
so yes, he's asking, still his blood pressure is high.
Well, so since the patient is only on one medication, then we have not fully maximized his medication or optimized his medications. So typically nowadays, when the person is having hypertension of blood pressure 150, we would start the patient on at least 2 medications immediately. So by starting 2 medications, the control is better rather than starting a patient on a single medication. And usually we would choose other forms of medications, for example, the ACE inhibitors or the ARBs or the diuretics and calcium channel blockers as the first line. Usually bisoprolol usually considered as the second line of medications rather than first.
So that means you advise like combining medication is better than taking a single medicine.
Yes.
Single medicine. All right. نرجع لك الأخ عبد الرحمن. زي ما أنت ذكرت إنك عندك بتاخذ علاجات لارتفاع ضغط الدم ولسه ما ضغطك ده مرتفع، وبتاخذ حبوب الكونفور اللي هو نوع واحد من العلاج مرتين في اليوم. زي ما ذكرنا دكتور حفيظ بالنسبه لعلاج ضغط الدم بالاضافه للادويه زي ما ذكرنا الحاجات الثانيه اللي هي النظام الغذائي والرياضه وغيره. لكن زي ما تكرم دكتور حفيظ ذكر انه يعني دواء واحد ما معناها انت خلاص اخذت العلاج كامل. يعني احنا قبل ما يعني نمشي لخطوه ثانيه، يعني عاده في امراض ارتفاع ضغط الدم الافضل انك تبدا بنوعين من الادويه، وده في العاده ودي الحاجه الافضل عشان ما تدينا يعني بيقولوا شنو اللي هي يعني كنترول كامل للضغط بتاع لارتفاع ضغط الدم. فزي ما ذكر الدكتور حفيظ هو انك انت تاخذ الكونفور عاده هو ما العلاج الاول او ما الخط بتاع العلاج الاول اللي احنا بنبتديه. عاده بنبدا بالحبوب اللي بتقلل كميه السوائل في الدم اللي هي بنسميها مدررات البول او الديوريتكس. بندي معاها الحبوب الثانيه اللي هي الاي سي انهبيتورز، فدي بتعمل يعني توازن جيد لضغط الدم. فانا يعني بقول لك يا اخ عبد الرحمن اذا كان عندك اي اشكاليه عايز تراجع ضغط الدم ممكن تتابعنا في عيادات المركز. مرحبا بك. Okay. Before we go further, Dr. Hafiz, okay. Some patients they are asking, I have this high blood pressure. Do I need to take aspirin?
Right. Well, if the patient does not have any cardiovascular risk factors, or if you want to take aspirin as a primary prevention, it's usually not recommended. It's usually recommended for secondary prevention in the event that the patient has other problems. For example, he or she has history of heart attack or stroke, then it's worthwhile starting the patients on aspirin.
But mean aspirin is not
indicated in all hypertension patients. Yeah.
And what about patient having like other medical problems, not only high blood pressure? Say for example, they are having diabetes, having high cholesterol.
Yeah.
What do you recommend? Aspirin or no aspirin?
All right. So hence, in such a case, we should calculate the risk score ideally. By calculating the risk score helps us to determine whether the patient can be started or should be started on aspirin and also statins, because there's a newer way where you can put in your age, your risk factors, your blood pressure, the kinds of medicine that you're taking, and then your cholesterol level. By incorporating the cardiovascular risk score, you can calculate the risk for about 10 years and then consider a patient to either start on aspirin as well as statins. And if the patient categorized under a high risk group, then you should consider starting them on those medications.
All right. ده بالنسبة لأخذ حبوب الأسبرين. يعني في كثير من مرضى ارتفاع ضغط الدم بيقول لك أنا عندي ضغط دم فبالتالي أنا أخذ الأسبرين عشان أعمل حماية لنفسي من أمراض الشرايين، لأنه طبعا في ارتباط ما بين أمراض الشرايين وارتفاع ضغط الدم. فالدكتور حفيظ بيقول لنا إنه أصلا الأسبرين ما جزء من العلاج لارتفاع ضغط الدم ولا هو يعني من الأدوية المحبذ أخذها، لأنه أي نوع من الأدوية عنده آثاره الجانبية، لكن في مجموعة من المرضى قد يكونوا محتاجين لهذا الأسبرين، بالذات المرضى اللي كان عندهم ارتفاع ضغط الدم وحصلت لهم يعني سكتة دماغية أو ذبحة قلبية أو عندهم أي مشاكل في الشرايين الطرفية، فهم بيكونوا محتاجين إنهم ياخذوا الأسبرين كعلاج مع الارتفاع ضغط الدم. ده بالإضافة لأنه مرضى السكري ومرضى ارتفاع الكوليسترول في العادة إحنا بنبدأ معاهم علاج الأسبرين إلا إذا يعني عندنا هو حاسبة بنحسب بيها نسبة حدوث المضاعفات بالنسبة للمرض خلال 10 أعوام. خلاص، فدي بنشوف نسبة الكوليسترول، نسبة إذا كان هو من المدخنين، نسبة إذا كان عنده سكر، ومعدل قراءات ضغط الدم. فإذا كان هو من المجموعة في يعني المعرضة أو في المجموعة الأكثر خطورة إنهم تحصل لهم السكتة الدماغية أو الذبحة القلبية، بنقوم بنديهم الأسبرين، يعني بيكون هو مسموح لهم. We are around the end of our talk. We thank you very much, Dr. Hafiz, for your elaboration about this one. I think we are going to get more questions. Maybe I will follow you and just to get me a reply on that. And then we can reply to our following Facebook. We thank you very much, and we hope our people will make use of this. Thank you
very much.
بنشكر دكتور حفيظ على حضوره معنا في هذه الحلقة وحديثه عن أمراض ارتفاع ضغط الدم، وزي ما ذكر لنا إنه هو من الأمراض الشائعة بإمكاننا أن إحنا نتجنب مضاعفاته وآثاره الجانبية من سكتة دماغية وذبحة قلبية وأمراض الفشل الكلوي، اللي هي بإجراءات بسيطة إحنا ممكن نعملها من تمارين رياضية، التنظيم في العلاج و يعني التنظيم وتنظيم الأكل والرياضة، دي كلها ممكن تجنب لنا أمراض الدم. بعد ذلك الالتزام بالعلاج وأخذ العلاج في مواعيده، دي من الحاجات المهمة جدا جدا. بالإضافة لأنه ذكر لنا العلاجات الحديثة اللي هي تحدث لنا عن الرينال دينرفيشن، أو هي تكسير الخلايا العصبية الموجودة في شرايين الكلى، لأنها ممكن تقلل من ارتفاع ضغط الدم. في الختام يعني بشكر كل المشاهدين، وإذا ما سمح لنا الزمن إننا نحن نجيب على كل أسئلتكم، فمرحب بكم ترسلوا كل الأسئلة، وإن شاء الله حنقوم بالرد عليها مباشر على صفحة الفيسبوك العربية حديث قلبك. الحلقة القادمة إن شاء الله حنتواصل في كثير من المواضيع، احتمال نواصل الحديث عن ارتفاع ضغط الدم. Okay, we thank you, Dr. Hafiz, again, because as you know, high blood pressure is a big topic, and maybe we need another session with you to just to cover the other question that we couldn't manage to cover it for today. And we thank you being with us for today.
Thank you very much.
Assalamu alaikum.